So shall we start? Sir, shall we start?
I think we'll wait for Auto Mehta to join.
Sir has come.
Acha, then start. Please.
Yes. Thank you, sir. Good afternoon, everyone. Today we'll be having a case conference, and since the conference is being recorded, we'll not identify take the name of the patient. I am presenting a case of 23 years male index patient who's a student of class 10, and still trying to pursue her class 11, not working, Hindu, resident of Tihri Garhwal, with the identification mark of a mole in tip of the nose. The information given is by father. He is Mr. Magdoum. His age is 51 years. He is studied till class 8. He is working in a Doon club as a bartender. And he's been staying with the patient for most of the times of the illness. They belong to a lower middle socioeconomic status and living with the patient for most part of the illness. History is adequate and reliable. It is clear, consistent, coherent in chronological orders, with chief complaints characterized by opioid intake in form of smack since past 4 years, opioid intake in form of injection heroin since past 4 years, cannabis intake in form of sulfa since past 2 years, decreased interaction with family members, decreased self-care, decreased activities of daily living, and suspiciousness since past 1.5 months. History is insidious in onset, continuous, and progressive, perpetuated due to intake of multiple substances, including smack, sulfa, heroin. History of present illness. Patient was apparently well 4 years back when he completed his high school and changed his school as a patient wanted to take a science side. Patient got his school changed to a same place nearby. He took science side. There, he met with his new friends and new people. He made new friends. Initially, he was regular in school like before, but then gradually, in a span of 2 to 3 months, patient started taking smack with his friends for recreation purposes. He initially tried with his friends and shared it among them. He liked and felt calm and relaxed after taking the substance. So he took it another time, which costed him rupees 500 a bit, and he shared with his friends. Patient started like the company and the after effects of the drug. Thus, he started consuming drugs on regular basis. On days when he could not procure the substance, he would have severe sickness in form of body pain, watering from eyes and nose, gooseflesh, to combat which patient would again take the substance. With time, patient stopped focusing in his studies and found science difficult. He tried to change his stream to arts now. Teachers would often complain to his parents that patient is lost in himself and does not involve in studies. He sits in class in a head down position and does not involve in any discussions. Family members also started noticing that patient would not remain in home for most times and would go out very often, unlike before. He would ask for money often. He would not get involved in any of the household chores or functions like before. He would spend more time in washrooms, and after 7 to 8 months on checking his pockets and washrooms, which was full of smell of smoke, father found multiple syringes and used needles. He asked his son directly, and then he got to know that patient has been into drugs since past 1 year. He couldn't qualify his class 11 and parents were disheartened for the same. Then his parents decided to send him to a nearby rehab center. Patient remained in rehab for 5 months and abstained from the substance. His health and grooming improved. He requests now, after coming back home, he requested his parents to allow him to go Dehradun to pursue his studies further and also find a job for himself. After several times asking, his father finally agreed to it. He joined Guru Ram Rai school in class 11, took arts, and again got into a bad company of friends. Now he started consuming smack in more frequency and quantity as it was more easily available. Also, when his sickness would not resolve, he would take injections of morphine and inject it in veins of lower limbs or left arm. He would often use the same needles and sometimes made to share those along with his friends. His health again started deteriorating. He had to sell his scooty and phone. When his family got to know about it, he immediately admitted to him to a de-addiction center in Sri Mahendra Hospital for 1 month in year 2021. Patient became fine and was started on oral medicines, which was told to continue at least for the year. Patient went home and was regular on medications for 2 to 3 months. His father found a job for himself in Dehradun and he started earning 4 to 5,000 rupees per month. He worked for 4 to 5 months and now money was an easy access to him. He again started taking drugs. This time he started taking cannabis in form of sulfa. He would take 2 to 3 rolls per day, which would cost him rupees 100, which he would share with his friends. He would make a roll by mixing nicotine from the cigarette and sulfa and would enjoy, and subsequently he again started using smack in the span of 2 months. When all his money got finished and he was fired from the job because of his irregularity, he had to go back home. At home, he would remain irritated and would not involve with any of his family members. He would often complain of body pain and decreased sleep, but this time his father refused for any treatment. This continued for around 1 month, and then subsequently, his family members started noticing changes in his behavior. As reported, patient started sitting alone for most times of the day, for most of the days. He would not interact with his family members like before. He wouldn't sit and have lunch or dinner with anyone like before. Patient would not communicate with anyone. Some days he would come to the dining table when coaxed multiple times. Other days he would be irritable and would not respond to anything. He would keep to himself and would barely speak. He had no routine of getting up or sleeping while others doing it on time. He would just ask his brother to bring him a bidi, else he would not talk to anyone. He stopped going out of home. He would not leave his room or go to buy vegetables or go for a walk, which he would do before. His family members asked him what happened, but he did not reply to most of the times. He wouldn't even bathe or do any activities of daily living gradually, like cleaning or washing. He stopped dressing up or going out. He wouldn't take bath for 15 days or so. And when his family members scolded him for the same, he would not even respond to anything. And then some days he would ask his mother to prepare a meal for him. When she called her to have food with everybody, he said, "Pehle aap khao," and he would forcibly make her mother to have food, make her mother to eat before him, and would eat only when his mother had taken a bite. Unlike before, when asked why he was doing that, he would have, if he is having any problems, he would smile and would not say anything. Gradually, he started keeping to himself more. He started remaining withdrawn. He would sit in one corner of the room and would not even do anything. He would not even sleep with everyone, in spite knowing that there is no separate room for him. He would make a tea or a Bonvita milk for himself, pouring 2 to 3 spoons of sugars and Bonvita in one glass of milk, in spite of repeatedly telling that this is not the way it is made. He would drink teas and milk 2 to 3 times in the night and would not uh, take any other meal and would use only the phones. His grooming and hygiene further deteriorated. Seeing the progression in complaints, patient is being brought to the hospital for management and treatment. Negative history. There is no history suggestive of thoughts being known to all or thoughts being heard out loud. No history suggestive of self-talking, self-muttering. No history suggestive of hearing voices not heard by others. No history suggestive of persistent elevated mood or persistent depressed mood. No history suggestive of any free-flowing anxiety. No history suggestive of any significant head trauma or ENT bleeds. No history suggestive of any seizure disorder. Treatment history. There are no treatment records available. Although patients attended reported of admission in de-addiction center in Sri Mahendra Hospital for 1 month in year 2021. In past history, there is no history of similar complaints in the past. No history suggestive of hypertension, diabetes, asthma, thyroid, or any chronic illness. No history suggestive of any blood transfusions or surgery. Family history. Patient is living in a nuclear family with parents and 3 siblings in Tihri. He is a second order child out of 4 siblings. Elder sister is married at Delhi 5 years back, and younger 2 brothers are studying in the school. Father is the financial head of the family, and mother is the emotional head. They own a house, and there is no history of any psychiatric illnesses or any chronic illnesses in the family. Childhood history. He is a normal term vaginal delivery at home done by DAI. No antenatal or postnatal complications were reported. Patient cried immediately. Immunization is complete as per the age according to the national immunization schedule as reported. There are no developmental delays reported. Home atmosphere. There is no history suggestive of parental desertions or adoptions. Childhood history. No history suggestive of any increased activity, temper tantrums, enuresis, or shy nature. In education, patient started schooling at the age of 3 years in TD. He was a good regular student till class 10, was an average student, passed with a second grade in class 10. Patient is not working and still trying to pursue his class 11. In examination, journal appearance, no pallor, icterus, clubbing, cyanosis, or lymphadenopathy. His blood pressure was 120 by 70 millimeters of mercury taken in left arm in supine position. Pulse rate is 86 beats per minute taken in right radial artery in lying position. In local examination of the lower limbs on inspection, there are multiple injection marks on left and right iliac region, most likely in the femoral vein. There is continuous bluish discoloration of veins with multiple puncture marks. However, there are no sites of abscess and no pain in the region. In cardiovascular examination inspection, chest is bilaterally symmetrical, no precordial bulges, moving equally with respiration. Palpations soft and non-tender. Apex beat is felt at 4th intercostal space, medial to mid-clavicular line. In auscultation, S1 and S2 are heard. In respiratory examination, chest is bilaterally symmetrical. In inspection, chest is bilaterally symmetrical, no precordial bulge, moving equally with respiration. Palpation is soft, non-tender, trachea is central in position. In percussions, resonant note was heard. On auscultation, bilateral chest entry is clear, no added sounds. In abdominal examination, inspection, bilaterally symmetrical, all quadrants are moving equally with the respiration. Umbilicus is central and inverted. On palpation, soft, non-tender, no organomegalis. On auscultation, vowel sounds were not heard. In central nervous system examination, patient was clear, conscious, comprehensible, fluent. There was no aphasias or apraxias. In sensory system examination, patient responded to bilateral upper and lower limbs on touch, pressure, position. Reflexes were normal in both upper limb and nose.
बोलो 5 मिनट वेट करें तो वेट नहीं तो कुछ क्या करें और ये ना इनको बोलना अटेंडेंट को कि अटेंडेंस लिस्ट ले हमारा.
In mental status examination, journal examination, he is a mesomorphic built young male, estimated as per the age, entered the room with unaided with wide arm swing gait, sat on the chair provided, had poor grooming and hygiene, long unkept hair and beard, having foul odor, wearing dirty clothes with food spilled all over, wearing pajamas and sweater, was making an adequate eye contact and was in touch with the surrounding. His attitude was cooperative but evasive. Repo is not established. His psychomotor activities decreased. Speech is decreased in tone, volume, and intensity. However, it was relevant, coherent, goal directed with increased reaction time. His attention was arousable. Patient was able to do digit forward and backward. 27 replied 27 195 195 3728 3728. Saying attention is arousable and sustained. Oriented, patient knows where he was, what time of day it was, and whom he was accompanying. Thus, patient was oriented to time, place, and person. In memory, immediate, patient was able to recall the 3 words after 1 minute and 5 minutes. The immediate memory was intact. Recent memory, patient remembered what he had in the breakfast and dinner last night. Thus, patient recent memory was intact. Remote, patient was able to tell his school name and his friends. Thus, his remote memory was intact. Abstract ability, patient was able to mean the proverbs, which is known as surroundings. Pet mein, like pet mein chूहे कूदना, नाच न जाने आंगन टेढ़ा. He was able to tell one difference between the orange and the apple. Thus, his abstract ability was abstract. He was able to do simple verbal calculations. He was able to do simple verbal calculations. In intelligence, patient knew the Prime Minister of India, the capital of India. Thus, his intelligence was intact. In mood, patient said, "Man vichlit rehta hai." Affect is shallow, non-mobile, non-communicable. In thoughts, stream, poverty of speech is present. No in form, no formal thought disorders. Position was self and content. Patient was preoccupied with somatic complaints and reason for admission being the body pain. There were no sensory distortions and deceptions reported. Judgment was intact with insight of grade 1. Diagnostic formulation is a 21-year male index patient, educated till class 10, student, second or the child out of 2 siblings, right-handed, resident of TD, belonging to lower middle socioeconomic status with past history of admission to de-addiction center at Sri Mahendendresh Hospital due to opioid dependence. Dependent disorder in 2021 has been brought to the hospital accompanied by father with history adequate and reliable, with complaints insidious in onset, continuous and progressive, with history perpetuated due to the intake of multiple drugs like opioids, cannabis, with complaints characterized by opioid intake in form of smack since past 4 years, opioid intake in form of injection heroin since past 4 years, cannabis intake in form of sulfa since past 2 years, decreased interaction with family members, decreased self-care, decreased activities of daily living, and suspiciousness for past 1.5 months. Has been kept on the differential diagnosis of undifferentiated schizophrenia with mental and behavioral disorders due to cannabis dependent syndrome, withdrawal state uncomplicated, with mental and behavioral disorder due to opioid dependent syndrome, withdrawal state uncomplicated, with a second differential of mental and behavioral disorder due to cannabis induced psychotic disorder, predominantly schizophrenia like, with mental and behavioral disorder due to opioid dependence syndrome, withdrawal state uncomplicated.
Any questions? बताओ क्या क्या डिस्कशन है आपका? मैं बंद करो. First of all, you are there. HFK में do you have any query? क्या आप लोग को diagnosis clear है? Any query in HFK? Any query in physical examination? The lymph node देखे?
Sir, tomorrow.
और MSc ओके पहले एसओपीआई में तुम्हारी रीडिंग अगेन एंड अगेन कि आपको जो एसओपीआई के रूल्स है वो नहीं छोड़ने हैं आपको निकोटीन मेंशन करने की जरूरत नहीं है उसमें ठीक है यूजन में टोबैको मिक्स कर रहा है वो तो उसमें निकोटीन तो साइकोएक्टिव सब्सटेंस है लेकिन वो टोबैको मिक्स कर रहा है ना कैनाबिस में और तो मतलब ये मिक्स कर रहा है बट इट इज इंपॉर्टेंट कि आप यू मेंशन कि again fell into bad company ठीक है so we should be non-judgmental bad company किसकी bad company और प्लेस है या और bad company है तो मतलब although the patient ने कहा है तो मतलब लिखे that's different issue but मतलब I will rather avoid कि why will label someone as bad company the patient can be bad company for others also ठीक है so you have to be non-judgmental even though we are presenting as okay third तुमने negative इसमें फिर से medical terms use कर दिए negative is also part of HOPI okay no negative शुरू किया कि no insertion of no throat thing is throat no heard by the throat thing बाद में तुम उसमें आ गई फिर से कि no ENT problem ठीक है ENT रेडी नहीं है नहीं बोला एक और भी बोली थी लास्ट में नो सीजर डिसऑर्डर नो सीजर डिसऑर्डर ना सीजर डिसऑर्डर तो हमें नहीं पता होता नहीं हुआ भी चल जाएगा सीजर डिसऑर्डर तो बिल्कुल मैनेज कर सकते हो नहीं नॉन एक्सटॉनिक उसके बाद आपने पर्सनालिटी क्या बताया मतलब तुम्हारा इंप्रेशन क्या था वैलिडिटी पर्सनालिटी एनीवे बताओ ठीक है उसके बाद यू कम टू एमएससी में छोटे-छोटे पॉइंट है इट इज ज्यादा बेटर कि तुम डिजिट फॉरवर्ड डिजिट बैकवर्ड के नंबर्स ना बताओ ठीक है समटाइम्स वन आस्किंग दे मेटल ऑल्दो सम सीधी एडवाइस कि आप इंप्रेशन तो लेकिन बहुत कंफ्यूजिंग है उसके बाद and digit forward digit backward test is also a test for working memory that is immediate memory so you can mention your immediate memory intact on the basis of digit forward digit backward test ठीक है वहां पे तुम वो देने की जरूरत नहीं है एक बार अपना अफेक्ट फिर से बोलें प्लीज
Affect is shallow, non-mobile, non-communicative.
So why have you not covered whether it's reactive or not?
Sir, shallow में तो we don't write anything.
Shallow में?
So we don't write anything, any other thing.
Is it so?
कुछ भी नहीं
Why you want mention it? I don't think so. ऐसा है but you see ऐसा है क्या non mobile or
non communicative
why you not mention it as per the मैं या discuss with हूँ as per the ऐसा नहीं है इसे चलो मैं नहीं ठीक है बिल्कुल कंपेयर मैं देखूंगा तुम लोग मुझे पता है
सर हमें बताया गया
चलो तुमने बताया तो बिल्कुल फॉर्मुलेशन यू मस्ट डू फॉर्मुलेशन इज मोस्टली मतलब थर्ड ईयर लेवल पे नहीं है ठीक है फॉर्मुलेशन की सुनेंगे इवेंचुअली आपकी उसमें कि फॉर्मुलेशन मतलब बहुत सारी हिस्ट्री का पार्ट मिस हो जाएगा जब भी हमारी फॉर्मुलेशन हम मतलब तुम देयर आर मेनी वेज ऑफ फॉर्मुलेशन वन फॉर्मुलेशन इज कि हम एक ही लाइन में प्रेजेंट करते हैं एक ही सेंटेंस में लेकिन देन स्टार्ट होती है तुमने ये बताना होगा पास्ट हिस्ट्री क्या है वैलिडिटी परसेंटेज presented the chief comment of this ठीक है तुमने ऑप्शन सब मिस कर दिया पास और फिर तुम मेंटल स्टेट ट्रांजिशन फाइंडिंग बोली नहीं फॉर्मुलेशन मेंटल स्टेट ट्रांजिशन कैसे मिस कर दोगे हम किस बेस पे डायग्नोसिस करेंगे डायग्नोसिस फॉर्मुलेशन के बेस पे डायग्नोसिस करना है तो हम तुमने शुरू में नहीं बोला एनीवे वो बात तो बात नहीं है इस फॉर्मुलेशन तुमने एचओपीआई में चिप कमेंट बोल दिया एनीवे तुम मस्ट मेंशन वन लाइन पेशेंट दिस तुमने बोला तो वन लाइन यूज कर सकते हैं और कोई नेसेसिटी नहीं है दैट मैंने past history nil validation personality no family history no medical history presently check comment of your debut in the formulation this with last interval whenever you are mentioning a substance distribution में diagnosis बनाना है मैं तो करूँगा withdrawal वाला उसको एक कर दें जो
so last take पता नहीं है like query
तो बताओ last 2 months back 1 month back opioid class intake कब है हमारे?
Very 1.5 months back.
और cannabis का?
Very 1.5.
हाँ, और onset of symptoms?
1.5 months.
When can we call it cannabis induced?
वो different question. Diagnosis की बात ना वो आ रहा है cannabis induced psychosis रहता है but अभी तो तुम ये चीजें जल्दी से improve करो the most of the things are in very broader और HPA was also fine more or less ये तो मतलब ठीक है तो अच्छी बात है but formulation जल्दी से ठीक कर लो एक बार formulation को बाकी चीजें में से चले और basic को नहीं है आपको बेसिक मिस्टेक्स हैं जिसमें छोटी छोटी जगह लेकिन बेसिक मिस्टेक की आपको मेडिकल टर्म्स यूज करनी है एक ऑर्डर में देना है हायरार्की मेंटेन प्रोनाउंसिएशन मेंटेन करनी है चेक कंप्लेंट्स में ठीक है तो नाउ ऑन दिस डायग्नोसिस स्किज़ोफ्रेनिया के पार्ट्स में क्या करना है
So the negative symptoms are present in the patient, which are like apathy, withdrawn behavior, paucity of speech, decreased social performance.
कितना नेचुरल है
1.5 months.
और
And sir, like change in the overall quality of life. Sir, personal and so self-absorbed behavior. Sir, E point in the sir E वाला जो point है.
एक पॉइंट है सिंपल स्किज़ोफ्रेनिया तुम तो अंडरस्टैंड बोलो सिंपल स्किज़ोफ्रेनिया में सिम्टम्स कितने हैं
Exactly.
मैंने डाउट तो है
Yes.
सिंपल स्किज़ोफ्रेनिया का प्रॉब्लम अंडरस्टैंड हो गया है
So interpolation in train of thoughts.
आपके एमएस में ट्रेनिंग इंटरपोलेशन ऑफ द ट्रेन ऑफ
So like the poverty of speech is present.
इंटरपोलेशन ऑफ द आई डोंट नो से वर्ड में मैच करें अगर डिरेलमेंट है या ये है तो मैच है डेफिनेटली आई डोंट नो फॉरवर्ड इफ इसको काउंट करेंगे नहीं करेंगे उसमें दे प्रोवाइड आई डोंट नो
This is suspiciousness be a patient
Suspiciousness can be very important, but then you have to have the criteria of delusion. ठीक है, चाहे delusion of reference भी हो, ठीक है, अगर आप उसको थोड़ा सा भी convincing कर नहीं शायद मिला दी थी, नहीं हाँ मिला दी थी, तो then you can make it better. मतलब कम से कम criteria नहीं मिलेगा. What are the points against schizophrenia?
So there are no first rank symptoms present.
ये कोई point against नहीं है. जब दो से second rank दो हैं तो point against नहीं. Point against की जो है तो उसे schizophrenia criteria नहीं पूरा होगा. What are the मतलब जो schizophrenia लिखा होगा कि first rank नहीं है कोई आंसर नहीं है कोई बात और
So since we are not sure about the substance,
इसमें mention है कि the symptoms must not be explained by the must not be colored by substance.
Depressive.
इसमें तो mention ही है.
Yes.
So then there is a significant temporal relationship with substance and reduction of symptoms. So that's the point against schizophrenia. वो तो mention ही है. Other than that, किसको परेशानी हो रही है? छुट्टी के लायक नहीं है अभी. So
डिस्चार्ज में चेंजेस करवाने हैं तो नया प्रिंट करवाना
अभी वेट करो जी करना पड़ेगा आपको बैठो अभी रुक जाओ
है 5 साल
बाहर बैठ
बाहर बैठी आदमी से
ठीक है और क्या डायग्नोसिस हो सकता है फिर हमारा
Some cannabis induced psychotic disorder with predominantly schizophrenia like with mental and opioid dependence.
Have you heard of cannabis induced amotivation syndrome? उसकी प्रेजेंटेशन क्या होती है?
Negative symptoms.
Negative symptoms. Anhedonia. So we find suspicion. family history question, past history question.
So okay, dependence, past permission.
ठीक है तो ऑनलाइन
सर कोई है
कोई मैसेज कर दिया क्वेश्चन ऑनलाइन करके मैसेज कर
सर ये दोनों ही हैं बस।
ओके ठीक है बताओ कैनबिस से मोटिवेशन कितने देर बाद होना चाहिए क्या है रोजा तो भी सब्जेक्ट को So why you didn't keep mental impairment disorder due to them or
induced psychotic disorder.
That's cause depression.
So because
What are the points again?
so because the last intake is not known, the amount of substance, the duration of intake of substance is not very much clear for the patient, from the patient.
But patient was continuously spending up to 100 rupees daily. ठीक है और काफी टाइम से हम लोग पर duration कितना
So जो हमें like 2 years.
2 years है तो मतलब even a single intake of cannabis can cause psychosis. That's why unlimited knowledge. So it doesn't go against